So in this today's topic, we are going to discuss about mental health nursing. It's also called as psychiatrist nursing. What is the mental health nursing? Before knowing about mental health nursing, we should have always know the vital component of our health. The vital and major component of health is physical, mental, social components. It also includes spiritual component in health. So, according to WHO, the health is defined as a state of complete physical, mental, social well-being, not merely the absence of disease. What is health means? It's a state not only about absence of disease, but if a person is having complete physical, mental, social, and spiritually, if it is well, apart from absence of disease, it is called as a health. Whereas in mental health nursing, this mental health, the mental is a vital component and it is an integral essential component of the health. Now we will see about mental health. Mental health is also related to the promotion of mental well-being and prevention of mental disorders and treatment and rehabilitation of the people affected by the mental disorders. So nowadays we all know that mental health, there are many people who undergo mentally ill, like some basics due to emotional instability. It can lead to depression and schizophrenia, some schizophrenia, and also some other neurological disorders also. But most dangerous and most vital, most commonly seen mental disorder or a mental illness is depression. So to cure such mental disorders, we need to know what is mental health. So mental health, what I mean by mental health means it's related to promotion of mental well-being, prevention of disorders, and treatment of rehabilitation of the people who are affected with the mental disorders. It is the main aim of the mental health. If we talk about meaning, it's a state, the mental health is a state of a balance between individual and surrounding world. It's a state of balance between the individual and the surrounding world, and a state of harmony between oneself and others, and a coexistence between reality and self, that other people and environment. It means the mental health or a mentally stable person state is nothing but it's a balance state of balance between, it's a balanced state between the individual and also between the surrounding world. There will be harmony between oneself and other self, and there will be coexisting of a reality. There will be existence of a reality of a self and also other people with the awareness of the environment. The person or individual who are mentally healthy, they always keep a balanced state between one individual to surrounding worlds, and also they'll have a self harmony and others coexistence harmonies will be there, and also the self awareness, and they will have a realistic environment, and the person will be aware of the people, the situation, and also the environmental condition around the person. It is called as mental health. If we talk about definition of mental health, according to WHO, they have defined mental health as the state of well-being in which individual realizes his or her own ability, which can cope with the normal stress of life and can also work productively, and they can able to make contribution to his or her family. So according to WHO, what this means, it's a state of well-being of an individual realizing their own ability, with their own ability, that are able to cope with the normal stress of life, and which they can work out productively to make contribution of the family members in a easy state. It is called as mental health according to WHO. If we talk about another definition, that according to Carol Minger, according to Carol Minger in 1947, he defined this mental health as an adjustment of human being to the world and to each other with a maximum effectiveness and also happiness. So according to, if we talk about Cargill, or you can say Carl, so the Carl in the 1947, he defined the mental health as adjustment of a human being to the world and to each other with a maximum effectiveness and happiness. It is called as mental health. It's a very easy definition who can understand, who each and every person can, how they can understand easily. Next, we'll talk about components of mental health. So what are the components? There are mainly and basically three main components. To be mentally healthy, every individual or every person need three main components, that is ability to accept self, capacity to feel right towards others, ability to fulfill life's task. See, ability to accept self means the person should have a ability. If a person or individual does any mistake, or if we do any good thing, more specifically the persons who accept good, he should also have a capacity to accept the self mistakes by his own, by realization, without anyone's involvement. It is called as ability to accept self. What are the wrong thing or any mistake committed by individual should be accepted by himself without anyone's involvement or without anyone's argument. It's called as accept self. Next is capacity to feel right towards others. So accepting self is not enough. Individual must feel that other person is also right. You should feel right towards others. Suppose if you have done any mistake and the other person is correcting your mistake, then you must agree your self mistake and also you should feel right. Like, yes, that person who is saying about my mistake is the right person. He is telling in a right way. He does the right job. Or suppose if you have done any mistake in a procedure and everyone is teasing you, and a person, if he corrects your procedure's mistake, then others including you should feel he is right without making any issues or without feeling jealousy. You should have a capacity to feel right towards others. Next, ability to fulfill life's task. See, in every daily life and all, we need to fulfill our tasks, like from daily routine to our job purposes, for studying purpose, everything. So, individuals who are mentally healthy, they should have the ability to fulfill the life task in a correct way. If any mistake or if any disturbance in fulfilling their life task can lead to mental illness, can deviate their mental health state to wrong way. It is called as about three components. These are the main and most essential components of the mental health nursing. They are ability to accept self, capacity to feel right towards others, and ability to fulfill life's task. Next, we are going to see about indications. So, indications of mental health. We already know which are called as indicators, like positive attitude towards self, growth and development, ability to self-actualization, integration, autonomy, perception of reality, environmental mastery. See, indications of mental health means when, at what time, at what situation or what conditions the individual is called as mental health. It is called as indications of mental health. They are indicators is nothing but you should have positive towards self. Always, if many members say a negativity towards self, you should always say a positiveness. You should always have a positive attitude towards yourself. How many negative members or negative words have been heard? Okay, now next is growth and development and ability to self-actualization. Self-actualization is nothing but, so self-actualization means it's the ability of a person to realize how he is developing, how he is improving, or how he is growing and act according to his environment. It is called self-actualization. Realizing himself, whether he is going in a right way or a wrong way. It is called self-actualization. Next is integration. Integration means if individual does any of the tasks in the daily life, he should be integrated to it, and he should be having coordination towards others. And he should have integration towards the task what he does without or with the minimum involvement of other individuals. Autonomy. Autonomy, you can say this autonomy as independent self-direct task. Means the person will do his task without any other involvement and without depending upon the others in a proper direction way. Okay? Means setting up a goal, moving according to the plan. It's called as autonomy. Next, perception of a reality. All the time, mentally healthy individual will have a correct perceptions on the reality. Not correct, exactly not the things, but he should have a reality perception in a daily life. Means, like if he does a good thing, what is the outcome? He should have an idea about what is the outcome of his task. If he does a mistake, what is the outcome of that? Now, in example, I'll give you. Suppose the patient is having a high BP, and if you are checking the vitals, by mistakenly you have said BP is in a normal state, then what is the outcome of that? Patient will think that he is having a normal BP, and he will be neglected with this health state, thinking any other cause might be for his signs and symptoms, which can lead to myocardial. Patient is having increased high BP. If you say he is having normal BP, hypertension can lead to myocardial infarction easily. So they won't follow any diet pattern. This hypertension patient, they should be very careful. They won't follow any diet pattern. They will neglect their medications, and they will neglect their signs and symptoms. Either it is severe also. So you should have a perception of what reality going to happen while performing a task. Then environmental mastery. You should always have the idea how the environment is, and you should have a mastery in the environment. Means suppose you are in a hospital emergency ward. Clients, there may be many emergency patients who are about to die or who are about to have any severe changes in their vitals. So if you had environmental mastery, means you should know what are the articles needed for that patient, where are the articles, what are the medications, where have been that medications have been placed. If you have this environmental idea, what thing is placed in a which part and where is it, and how to use that equipments or medications or drugs, how to inject IV fluids, in what situation, what type of the medication should be given. If you have these environmental ideas, then it surely is said to be a mentally healthy person. So these are the indicators. There are 6 indicators there. First one is a positive attitude towards self. You should always have a positive attitude towards the self even though you are in a negative situation. Second is growth and development ability towards self-actualization. As you grow and develop, you should have ability to have a self-actualization, self-realization. You should have integration towards the tasks what you perform or a person what you meet, what are the daily routine. You should have integration towards it. You should have a autonomy, and there should be perception of reality in a mentally healthy person. Okay, you should have a perception of reality. Then you should have a environmental mastery. Always this environmental mastery is the most important indicator with the positive attitude. So these are the indications of the mental health. Next we are going to say about 7 signs of mental health. So how you can say that individual or a person is mentally healthy? Always 7 signs. If the person is having these 7 signs, he is said to be a mentally healthy person. They are happiness, control over behavior, appraisal of reality, effectiveness in work, healthy self-concept, satisfying relationship, effective coping strategy. So first is happiness. Happiness in sense, it's not like person is always smiling, always laughing. Happiness means whenever the, if you say a mentally healthy person, he will have a smile and a brightness in his face. Means if any mentally ill patient or any client or any mentally disturbed people see that individual, means that person should feel relaxed and very happy and charming. So this is called as happiness. Okay. Next, control over behavior. The mentally healthy person will always have a control in his behavior. He acts according to the situation. For example, if there is a meeting in the school, parents teacher meeting, or if there is any function or any school day functions is going on in school, mentally healthy person will behave according to the situation and does not overreact or does not be introvert. He will be according to the situation. He will control his behavior changes. Means the mentally healthy patient will behave differently with each person. Like he will behave according to peer group. He will behave happily or chit chatting like that. In front of teachers, he behaves very respectfully, silently. He obeys the teachers like that. So this individual with the mental health will have a control over behavior and act according to the situation. Appraisal of reality. Always mentally healthy person will have a idea of what is reality present. He does not overreact. He does not be in the imaginary world. So the mentally healthy person will always stay in a reality, in a presence of mind. He won't have an absence of mind, or he does not show any daydreamer. He won't behave like a daydreamer or scream and shout like that. So mentally healthy person will have a appraisal of reality. Effectiveness in work. mentally healthy person will always show effectiveness in his work. He does not show any disobedience. He does his work according to on the time, according to the situation and what is given to him. He solves the cases accordingly using the principles. So he will show effectiveness in this work, and he does not show any negative feedbacks. Yes, health is self-concept. Healthy self-concept means mentally healthy patient will always have a healthful selfness. He will always try to be healthy by self, and no one needs to teach about health maintenance to him. So this is what about healthy self-concept. Next, satisfying relationship. Here, if you come about satisfying relationship, it does not mean about sex relationship. This especially in mentally health person means in mental health nursing, according to this satisfying relationship means it does not involves only the sex relationship between husband and wife. It also involves the interpersonal relationship between the group members, between the hospital setting members. There will be a satisfying relationship means if a team consists of doctor, nurse, dietitian, physiotherapist, like the pharmacologist, social workers and all, the team members will have a satisfying interpersonal relationship among each other. It does not mean about sex relationship, okay? Don't be confused. Next is effective coping strategy. So if a mentally healthy person, if you take, that person or individual will have a effective coping strategies. Suppose if in a family member any one of the member has been dead, so that person or individual mental healthy person will have effective copingness or a coping strategy from that situation. He will try to cope himself. He does not stay in the same sorrow, same depression as it was in the first day of their loss. So that person will have effective copingness in his situation. He will have coping in a strategy way. So this is what about mental health nursing. Tomorrow we'll discuss about some other components. Today in this class we have discussed introduction of mental health nursing, definition of mental health nursing. The two that we discussed about two definition according to WHO and according to Cadel Mininger, and we discussed about component of mental health, indicators of mental health, and 7 signs of a mentally healthy individual or a mentally healthy person. Next class we are going to discuss about the national health policies. Okay. So if you need any changes in my classes, please comment in the comment section, and please notify what are the changes should be done in my explanation. Thank you. Subscribe for more videos.